UC Health's integrative medicine is the first in this region to integrate a range of evidence-based services for patients, such as acupuncture, massage therapy, exercise, nutrition, mindfulness-based approaches, and lifestyle medicine with consultations with physicians. The clinic's multidisciplinary team will provide evidence-based therapies that focus on a healthy lifestyle. Our keynote speaker is Dr. Mladen Golubic. Dr. Golubic is the medical director for UC Health's Integrative Medicine, and he is a professor of family medicine and integrative medicine at the University of Cincinnati and co-chair of the UC Health Cancer Wellness Clinic. He is developing similar programs to serve neurological disorders in patients with chronic health conditions. Dr. Golubic has worked in the fields of genetics, and molecular and cancer biology, contributing to the understanding of interaction between the environment and our genes. His clinical work focuses now on lifestyle-related chronic diseases. Dr. Golubic will give us an overview of the programs at the University of Cincinnati and talk about integrative medicine as a strategy. Dr. Golubic?
Well, good morning, everybody. Thank you very much for joining us this morning. And I must say that it's such a pleasure to give a lecture, and there are humans in the room, so that we got used to just looking into that camera on our computers. So thank you, all of you, for being here. That is a big stress reliever for a speaker. And first of all, thank you very much, Chris, and the whole team at the Parkinson Support and Wellness for giving us the opportunity to share with you some of the ideas that we have, some of the work that we do. And I'm particularly excited to be with my colleagues here, whom you will see later, Mrs. Tina, our yoga therapist, Dr. Rastogi, and Dr. Walker, who will review for you the science behind some of the therapies that they use in their work and demonstrate practical things that you can actually practice at your home alone. So when thinking about this presentation, I thought about just mentioning, and I think Chris mentioned that very well, there is just one medicine, yeah, and that's the evidence-based medicine. A number of years ago, the father of integrative health, Dr. Andy Weil, published a paper with some collaborators stating how at the center of our healthcare should be self-care, the things that with minimal instructions we all can do. And then if self-care is not sufficient, there is a number of therapies that will mobilize that inner healing capacity that we all have. And if that is not sufficient, so if you have your lifestyle modifications and you work on a number of those traditional therapies that we'll be talking, then we should be using our modern molecular medicine high-tech interventions. If you look at what is self-care, that's essentially developed into field of lifestyle medicine, variety of treatment modalities to activate that inner healing ability we call integrative medicine. It's a huge spectrum, and I'll show you in a moment. And then our molecular medicine, that's what you see from your physicians, your neurologists, whoever is taking care of you with modern Western medicine. So clearly, the concept is, let's first form the basis, and then if that doesn't work, then we will go to the high tech. Often we kind of start at the outer ring, and then we go towards inner. So we'll be focusing on that inner two rings. This is the definition. What is integrative medicine? You probably heard the terms alternative, complementary, holistic, yeah. And over the years, it kind of gelled together under the term integrative medicine. And really the key is that partnership, that relationship between practitioners of different therapies and patient at the center of that interaction. Now, there are a variety of modalities, established medical systems, whether it's traditional Chinese medicine, Ayurvedic medicine, Native American medicine, you name it, that have different components, different modalities, and that's all under that umbrella of integrative medicine. Now, if you look at those different systems, you will find that all of them kind of overlap in certain areas, and those are the areas of, how do we relieve stress? Which kind of foods can we eat? And over the years, that component of those integrative therapies came around the field called lifestyle medicine for the past 30 years or so. And so this is the definition of lifestyle medicine. The key is here that every physician does lifestyle medicine. There is no doctor or nurse practitioner whom you have seen who doesn't want you to eat healthy foods, who doesn't want you to sleep well, who is not excited about telling you how to relieve your stress. But that is not the primary modality of intervention. In lifestyle medicine, the primary modality is type of foods that we eat, how do we relieve stress, what's the sleep, do we avoid toxic substances, and how we nurture the meaningful social interactions. One can understand that some of those food as medicine, movement as medicine, meditation as medicine can be used to prevent and avoid the disease. However, data are growing that you can arrest the progression of disease and in some cases even reverse chronic illness. I don't have a pointer here, so I cannot show here, but you can see that there are like 6 main areas of your self-care, from food choices, physical activity, stress relief, social interaction, sleep, and avoiding toxins. And all of those have pretty established common pathways, how they impact our health. And some of those we'll touch upon, how it relates to Parkinson's disease, and in turn to other chronic conditions. So, big challenge here is, yes, we all know that there are certain foods that are healthy and that we should not be eating so-called junk food. Everybody knows what that is. Yeah, we actually gave it a name. We know that it's a good idea to practice some relaxation techniques, but often we would hear, well, I know it's good, but I just don't feel like doing it. Oh, this doesn't work for me, that's too complicated. So what we'll try to show you today is that those are simple techniques, you can use them, and you have to make that first step to start practicing whatever excites you from that wheel. These are the 3 key concepts, and I'll come to that at the end, how you can implement some of those self-care practices. Number 1 is experimentation. You just have to try different things, because what resonates with me might not resonate with you. The second one is progress, not perfection. Just trying to focus on one small goal, doing it consistently. And then when you feel confident, you can kind of add additional activity or expand it. And the third one is very, very important, and that's evaluation, meaning looking deeply, who is behind the recommendations? Is that professional medical society, or is that somebody who just came up with some idea and it's writing books about it? So evaluation, critical evaluation. And here is our phone number for our center and the website addresses where you can find more information. And as I'll go through the presentation, I will show you some of those links. So, Chris has mentioned interaction, genes, and environment. And I think this is at the crux of our health and the disease. So these 2 photos from Time magazine indicate That was from 2003, when it was 50th anniversary of discovering the nature of our genes' DNA. And then in 2000, there was a report, large international effort, multiple institutions, billions of dollars, and we finally sequenced the genome, all the genes of a human being. And there was a big hope that now, when we know the genes, we'll be kind of saying, okay, yeah, this is the gene that is defective, we'll kind of fix it, we'll fix that. Turns out it was much more complicated. Number one, that wasn't complete sequence. Only recently, finally, all the gaps were completed. So now we can say in 2022, this was April 1 in Science magazine, we finally really know 100% of what we are, all the sequences. Yeah? And when it comes to lifestyle, it turns out that it's not just the gene that you have, but how that gene is modulated and activated. And diet plays a big role. This is from UC Davis Center for Nutritional Genomics, showing how there are different pathways through which certain foods, certain nutrients impact the gene expression. But then we quickly realized that physical activity also does that. And our emotions and our thoughts also influence gene expression. And then another layer of complexity is that circadian rhythm, exposure to day and night, use of those LCD screens, quality of sleep that might be impaired. And it turns out that about 10% of all the genes that we have are regulated by this circadian rhythm, day and night cycles. Yeah? And we have disrupted this profoundly. So, and then fairly quickly, it turned out that lifestyle, the practices that we do, from food to how we manage stress and physical activity, impacts the expression of those genes. And there are like switches, and those self-care modalities profoundly impact which switch will be turned on, to which degree, which one will be turned off. And this is just from popular press. You probably have seen that, how complex those interactions are. And then, if that wasn't enough, it turns out that we are mostly microbes. We have more microbial cells than we have our own cells. And it turns out that that adds another complexity, that what we have in our gut, what we have on our skin, determines as well how our genes will work, how our bodies will work. So this is where we are. The challenge is not now just knowing the sequence, it's what do they mean, how do they are regulated. That is the biggest adventure that we have. And in this cartoon said, I think I found a corner piece. That's where we are. So imagine 3 billion pieces puzzle, and you started, and we started, we found a corner piece, yeah? So I'll switch now to Parkinson's with this introduction to understand, how those interactions occur and what we can do about those. And I use a couple of recent reviews that have really summarized those concepts. So number one, there are certain number of genes that have been associated with risk of Parkinson's disease, and some of those I'll mention later, but there will be no quiz at the end. You don't need to worry about those names. And then we talked about this epigenetic, those switches that turn on and off the genes. And then on the right side, you see environmental risk factors. Yeah. And there are a number of those, and we'll focus on those non-genetic factors. We will not really talk much about genes, but I just want you to be aware that whatever we do here in our self-care has potential to impact those genes, impact the gut bacteria, impact the way the gut communicates with brain. This was a recent review where they just looked at the hundreds of studies that examined non-genetic contribution to Parkinson's disease. And the summary is here. the references at the bottom. If you want to go deeper, you can always go there. And for the sake of time and just the review, I'll focus on conclusions, and whenever appropriate, I'll show you some piece of data that I think it's exciting that will engage you into trying some of those techniques. So after looking at all of those different factors, physical activity, coffee, and tea are consistently associated with benefits. This is another meta-analysis just for bicycling. And you probably know about that, and you have certainly, many of you tried to do that. This is just to enhance that knowledge that physical activity, and in this case, in form of cycling, has benefits. Benefits for motoric symptoms and also for non-motoric, quality of life, PDQ-39, that's Parkinson's disease quality of life. If you ask questions, and people who cycle, they report much better different aspects of our quality of life. This review article is by my former colleague. I was at the Cleveland Clinic, and Jay Alberts was part of our wellness because of his interest in physical activity as it relates to health. And this is pretty strong statement: universal prescription for Parkinson's disease, exercise. Yeah? And they very specifically state here in this review how we know that aerobic exercise has benefits, numerous benefits, especially for brain function and structure. And then what would be the prescription? What would be the intensity and duration that you would have to do? And they came up with 3 times per week, 30 to 40 minutes. And now, 60 to 80% maximum heart rate. Yeah, nobody has a heart monitor and measures that, and you can calculate. And if you go and do any rehab, exercise rehab that we run at UC Health, they can determine that, they can test you. But one very useful thing, and they mention here, is to achieve intensity on the scale of the how you estimate your exertion scale from 14 to 17. And you can see in the right upper corner, so this is orange to red, 14 to 17. So it's kind of hard, it's not light activity to see the benefits that they report. Another popular thing that you can do is tandem biking. So sometimes you cannot have the speed and the frequency and power to do this, but if you just almost like a passively pedal and somebody else is the one who is moving the bike, you can still benefit. And this was one relatively small study because they were very comprehensive. And again, you can see here quite intense, 3 times per week for 16 weeks. Profound improvements, both in subjective and objective measurements. And one of those was increase in so-called brain-derived neurotrophic factor, BDNF. So those individuals who achieved improvement, as you see here, it says VO2 max, which means you are more fit. You can use more oxygen per gram of tissue. More fit, more outcome, more results from exercise, you have higher brain-derived neurotrophic factor. Neurotrophic meaning growth, and that is one of the factors that appears in the bloodstream, and the concentrations in the bloodstream correlate with concentrations in the brain. Now, what else happens when you increase brain-derived neurotrophic factor and many other ones? And that is shown here. This hippocampus is part of the brain that is involved into short-term memory. Those are those red dots on the picture here. And you can see here hippocampal volume decreases as we age. However, it doesn't have to be that way. And the research shows that the more you are fit, the bigger your fitness is, this VO2 max, the higher volume in hippocampus you have. Yeah, so it's not just that you see the increase in molecules as a result of physical activity, but you see also the effect on the brain itself. Yeah. What is exciting and how it shows how everything is interconnected is that practices such as yoga and Tai Chi and other mindfulness meditation practices can increase BDNF and many other things. They can impact the gene expression. I'm just trying to kind of show you here how, even if we focus on just one thing, there is this interconnection between what we do. And Tina will talk about yoga, and she mentioned some of those studies. The point here is we do not have large studies, and that's a challenge in the field. We have a number of small studies, and they are randomized and they are controlled. They are short duration because those studies are expensive. But whenever you look and you put those together and you consistently find the same story, and that is a story of benefit, improved strength, improved balance, reduced motoric symptoms, better gait, and less risk of fall. Yeah, so those are those benefits. Now, we went from high intensity, then we came to yoga practice, and then this is the newest study that kind of I found very, very exciting. It was done in Thailand, and it was a control study, and it was over a longer period of time. So what they want to do, they wanted patients with Parkinson's disease to be active at their home. Because of pandemic, they said, okay, you don't have to go anywhere, what you can do at home. And so they would walk like 10 meters, 30 feet, back and forth, and doing it mindfully for 30 minutes, and then after that they would sit down and meditate for 30 minutes. Yeah, so it was a combination of walking and meditation. Yeah, and even when you do it with that intensity, that is not really high intensity, and you incorporate meditation, you can see the benefits. Yeah, patients were adhering to it, they were excited about it, they were doing it. And then they report on the questionnaires specific for patients with Parkinson's disease, how much better they feel and how reduced anxiety they experienced. So yoga, Tai Chi, Qigong, mindfulness meditation, any other kind of meditation has tremendous benefits that just go beyond that physical aspect or reduced anxiety. There is increased flexibility and increased awareness. And many of those practices incorporate breathing techniques. And you will see today some of these demonstrations that you can always have. Is the cheapest, always available stress relief tool. And here is the idea behind it. When our ancestors observed something that we have all seen, yeah? We breathe differently when we are excited and when we are in fear or when we are nicely relaxed. We all know that, yeah? We hold our breath when we are tense, yeah? And when we are nicely relaxed, it's kind of deep, easy breath. So what our ancestors ask is, can we change our breathing patterns so that we would change how we feel? And the answer is yes. That's the whole science in all of those practices. You can go into any traditional medical culture and they will tell you how breath is important. And so we'll practice this today, and I will not go into the details. You'll just have to accept that there is good science behind it. I show this slide often. Late Randy Glasbergen really, recognized what's happening. Is that sometimes we feel like it's 100%. It's just kind of putting out of our ears the stress. So what we can do, clearly some of those techniques that I mentioned, and so Dr. Barbara Walker will be here, and I just put here the link, to her Mindful Mondays. Every Monday morning at 8:30, she teaches Mindful Mondays. It's virtual, you click on it and you join. Mladen McGraw does many teachings. She teaches for patients with neurological conditions. Some of you probably have seen her. I don't know why this is going automatically. So Mladen runs the courses, and some of you probably have taken some of those. Then we have here our Tai Chi and yoga therapist, Jennifer. She teaches for patients with Parkinson's disease. Many of you probably have seen her. And Derek does the same, and then Tina and Josie do yoga. And then we have Expressive Therapies team, Dr. Rustogi will be here today, and Betsy will not be here. But I'll just mention here that there is a very strong, solid body of evidence how music therapy can help patients with Parkinson's disease, and this is the reference for that. This is our website. You can go and click on classes and events, and when you do this, you will see the list of all those classes, and you can click here where it says register, and thanks to really generous support from the community, outpouring support for what we do, we are able to provide those classes free of charge. Many of those are recommended, but they are not covered by insurance, so it's a really bonus for our patients that they can use those modalities and learn and then practice on their own. Now, the next part of my talk is going to focus on foods, and when I put this slide, I actually borrowed it from one of my colleagues. I found it really very insightful in the sense that outside of religion and sex, probably nothing is as personal as our food choices, maybe politics. And so what happens, often people come up with an idea, they grab it, and they write all these fictional books about which diet to eat and what to do. And there is absolute confusion. And what they really like is to focus on individual nutrients and make the whole universe out of how this particular one is the most important and how we should do everything. So I'll try to focus on non-fiction part here. Again, there will be no quiz here, but I would also fail it, by the way. But I wanted to highlight here some of the processes, and all of those that are here that are believed to be the key molecular processes that happen in Parkinson's disease development and progression can be influenced by food choices, by diet. And clearly, one would need another symposium to kind of cover all of those, so I'll be fairly specific to explain that. Inflammation is a natural protective response, evolutionarily conserved. Without the inflammation response, we would not exist. The problem is when that inflammation comes in, when there is injury, infection, or trauma, infection comes in, the injury is repaired, and infection should, the inflammation comes up, and it should go down once the virus or bacteria is cleared and the damage is repaired. Problem is that because of our toxic environment, our food choices, our unhealthy lifestyle, that inflammation doesn't go down where it should be. It always stays a little bit up. And that's low-level simmering inflammation. It's associated with a variety of chronic conditions. And Parkinson's disease is in that other category. Yeah? There are too many to kind of list here. So I was thinking where to put acupuncture, and it just fits beautifully here because many of these processes, especially neuroinflammation, is something that in traditional Chinese medicine is considered as a very good target for intervention. So this is a map of meridians in the acupuncture, for acupuncture practices. And until very recently, we have seen the benefits, but again, these were small studies. And acupuncture can be used for a variety of chronic conditions. And Chris has mentioned, pain and anxiety, etc. But you can see here, there is, and this is by the World Health Organization. So what is considered appropriate diagnosis to treat? Now, the problem is the insurance, medical insurance doesn't cover for all of those, but at least it covers for some chronic pain that many experienced. I put this here just to tell you how rapidly that field has advanced. Until very recently, when you would read paper about acupuncture, it would be in some, integrative medicine journal. This paper here on the top left was published in Nature. Nature is a #1 top-ranked biomedical journal. And when I saw this, I was texting our acupuncture group and I said, have you seen this? This is unbelievable. Cutting-edge molecular science shows that there is profound benefit of acupuncture treatment. And there was even an editorial down. It says neurons that switch off inflammation, yeah? And those are activated by when you insert needles in very specific points. Even if you go and do the experiments in rodents with acupuncture, now there is no placebo. You can demonstrate when you put needles in specific points, changes in the brain and changes in the gut, and it kind of brings all of those things together, yeah? It's quite profound. So this is this other paper done in Korea, published in 2 years ago. So this is our acupuncture team. Derek, you have seen his face. He's also our Tai Chi teacher, and Sybil and Angela, who are spectacular acupuncturists and very holistic practitioners of traditional Chinese medicine. Speaking of pain, we are organizing a conference that will focus specifically on non-pharmacological approaches to chronic pain management. And this will be on May 14 at Graduate Hotel, and it will be in person. The information you can find down here at our center's website. So, going back to inflammation, yeah? Clearly there are many other modalities, but for the sake of time, we'll focus on nutrition. It has been shown, beyond any doubt, that fruits and vegetables and legumes are profound reducers of inflammation. And there is a number of studies. This is just one that shows the higher intake you have, people who consume the highest amount have the lowest level of certain inflammation markers. In this case, they looked at C-reactive protein, CRP, which is a very non-specific marker, yeah? So it's not, this is the marker that is the key for, any particular illness. But in general, it tells you there is something going on in regard to inflammation. As it comes to Parkinson's disease, there is a group of nutrients called polyphenols. There are like 4,000 of those. And they are in fruits and vegetables, and they are in those colored plant foods. And you can see here in the picture. And there is a growing body of evidence how these polyphenols impact our quality of the gut composition. They also impact the oxidation state, because that's believed to be one of the mechanisms, and reduce the inflammation. Yeah, very powerful. Again, it's not one polyphenol out of these 4,000, as many supplements kind of say, okay, we'll take this one out and pack it in a pill, and you just take this and everything will be fine. It's the whole matrix, the whole composition. Yeah, the more diverse colors you have, the better. We are failing miserably as a society. This has been the latest one, update from the CDC, what's the consumption of fruits and vegetables in the US. And you can see that we in Ohio are below 10% for the fruits and below 8% for vegetable. 3 servings of vegetables, 2 servings of fruits. And that is the minimum. Yeah? This is not like the high end. That's where we want to be. So we have enormous room for improvement. In fact, if you look at about 180 studies and you put them together into so-called meta-analysis, as is done here in International Journal of Epidemiology, you find that we should be eating 10 servings of vegetables and fruits, maybe 6, 7 vegetables, 3, 4 fruits. Yeah? And it's very easy to do this. You can see on the right side of the screen what is the serving. Yeah? Half a cup of beans, or full cup of raw green leafies, or half a cup of cooked broccoli, etc. This is so important because those type of foods are the food for our gut bacteria. They live from dietary fiber, undigestible carbohydrates. And the more diverse we are, the more diverse intake of fiber we have, the healthier gut microbiome we will have, the healthier we will be. I just want to tell you how impoverished we are with our gut microbiome. This was the study where they looked at fossilized poop from 1,000 years ago or so, or more, in the Southwest. And what they found is that about 40% of the diversity that they had at that time, we lost. We just don't have those bugs anymore in our gut. Yeah? And that's mostly because we eat a lot of processed, refined foods rather than unrefined plant foods. And the gut in itself is very interesting in the sense that the best way to improve your gut health, your overall health, is to eat fiber. And fiber is found only in plant foods, only in whole unrefined foods. And the changes in there impact how our brain functions. There is this constant interaction. There are neurotransmitters produced in the gut that eventually can end up in the brain. And people are trying to find that particular bacteria or particular combination of bacteria that will say, okay, here is, you can take this probiotic and now you'll be fine. And there are many studies that show that there are some benefits of particular, when you look at the genome microbiome, and then you find some of these species that might be associated with reduced anxiety or maybe better motoric control of symptoms. So it's a very exciting field. We are not there yet. By no means we know what's the most optimal way to do this. The one thing, when I talk to people who study that, eat your dietary fiber. That's the key. And I will go very quickly here. We actually come to understand, this was very recent study done, because you go into societies that have very low risk of developing Parkinson's disease. What's unique about it? And they are here, as they said, this group from Israel, quasi-vegan cultures. Yeah, most of them predominantly plant-based. Yeah, and not only this, they found how, because of that, 2 key genes that play a role in Parkinson's development and progression can be positively impacted. Yeah, clearly much more needs to be done. And if you randomize people in the Mediterranean diet that is rich in plants, vegetable, fruits, whole grains, a lot of beans, some fish, some chicken, turkey, skinless breast, you see the benefits. This was a randomized study done in Iran, showing the benefits in a variety of domains, yeah? Especially for the brain health, cognitive health. Now, there is such a confusion about which diet to follow and so on. US News and World Report ranks those diets every year. This is the ranking for 2022. You can access, you can look at it. And Mediterranean diet and DASH diet, and then below that will be MIND diet, which is All of them are variations of Mediterranean diet, very rich in plant foods, whole, unrefined, unprocessed, consistently rank 1 or 2 or 3 in the top 5, yeah? So when you kind of think, what should I do? What should I eat? This is the safest thing to do. In contrast, people are spending taxpayers' money to study the diets that until now have been really difficult to follow. You need supplements because they are so deficient in variety of things. And I'm just showing here a couple of those popular that are right at the bottom of the ranking from 1 to 40. So I'm not saying that in 20 years, modified keto will be, number 5, but really, you see this day and night difference in the type and the quality and the health effects. So this is by the American College of Lifestyle Medicine. Essentially, let's move from this, what we currently eat, processed, refined foods, white bread, white pasta, to whole grain, whole food, plant-based eating diet. How far you want to go on that spectrum, it's really up to you. Yeah? And that's what will help you. I put only one slide about supplements because I know people will ask about it. If there would be any particular effective supplement, your neurologist, your physicians will tell you about it. If there would be a solid science that experts agree that is beneficial. Again, when you read those papers, everybody's talking about natural compounds that are found in fruits and vegetables and beans and whole grains. So clearly the key is to eat those foods. There are 2 that I would encourage you to make sure that you take. One is omega-3 fatty acids, flaxseed, ground flaxseed, chia seeds, walnuts. If you eat fish, from fish, fish oil, or you can take algae-derived long-chain icosapentaenoic and docosahexaenoic acid, EPA and DHA. And then everybody should take vitamin D, at least 2,000 units, and take it with food. It's a fat-soluble vitamin, and based on the current recommendations, if anybody has any documented deficiency, clearly it needs to be corrected. Again, one nutrient is not going to be miraculous cure. I mentioned coffee and tea, and so this is caffeine. It's our modern society that is powered by caffeine. It's a very useful legal thing to do to keep sharp, and we have it here. So what's so exciting about caffeine? About coffee? Yeah, not caffeine, coffee. Yeah, there is caffeine. But look at this at the bottom. It says polyphenols. Where did I mention polyphenols? When we were talking about fruits and vegetables, those berries. In American diet, coffee is the main source of polyphenols. Why? Because people don't eat a lot of vegetables and fruits, as I have shown you, and they drink a lot of coffee. Coffee is a wonderful, healthy drink. Try to add healthy stuff into it. It's like salad. You can ruin it with salad dressings, The same thing, you can ruin coffee with what you put in it. So stay away from anything that has any sugar, that has any artificial flavors, colorings, etc. And I will wrap up here, focus on experimentation. I hope you'll be kind of excited about some of those things to try. Go slowly, step by step, build it up. You cannot jump from here to here overnight. And again, evaluate, including everything what I said. Oh, he's imagining this. I have read that, it's a good idea to do this. So please do that. And for physical activity, don't stress much, sit less, move more. Any activity is good. The more you're active, the more benefits. You'll be able to do this, and Tina will show you how you can get there. I'm just kidding, it's not going to be that way. But you have to have a goal, what will I do when I'll be 95? General guidelines for exercise, common sense, don't do it after you have eaten, be mindful of how you feel. If you're not feeling well, don't do it. listen to your body. I mean, you know your body. Yeah. So when we'll be doing those exercises, you say, okay, this doesn't make sense for me, so I'll skip that one. Yeah. This is very common when you start practicing meditation, any of those techniques, because you'll feel anxious. In our culture, we feel guilty that we are doing nothing, so to speak. Yeah. So again, you have to overcome that, and it happens with the practice. So eat food, not too much, mostly plants, as Michael Pollan said. Avoid those processed foods, and the industry is making sure that there is larger and larger number of those products, and it's increasing rather than decreasing. I hope you will change that after my lecture. I don't care what the doctor said, refined people don't eat unrefined foods. So eat unrefined foods. Don't chew like these guys, 72 hot dogs in 10 minutes, world champion. First of all, you don't want the processed meats, and you don't want to eat that way. Even if you eat green leafy vegetables, don't chew like this gentleman. 2.5 pounds, 17.5 seconds, okay? Or don't be Popeye. Yeah, spinach, yes, but not the way. This is summary of what you can do. Chew well, chew well, chew well. Remember that. Whenever possible, do it, and cook more, order less. This is the website where you can go. My former colleagues and dear friends, Dr. Mike Rosen and Chef Jim Perko, have like 80 plus videos with certain recipes. You can do that. Dr. Annie Fan, who we had privilege to have her here last year, she has Brain Health Kitchen. She's physician, also trained chef. A lot of information that you can find how to improve the health of your brain. And Dr. Melinda Ring from Northwestern has a wonderful TED Talk, which you'll enjoy. And remember, eat plants, keep moving, sleep well, be present, stay calm, and love people. And I will stop here. I'm so grateful for this opportunity. And we'll be taking questions.
Am I live?
Maureen, you on?
Yeah.
Yes. Mm-hmm.
Okay, great. We have one that came in about the polyphenols. Are those equal to antioxidants? Does that mean the same thing?
Yes. So polyphenols have many different functions in the cell. Some of them are antioxidants. And if you, for example, if you take a cup of kale and you say, which antioxidants are there, and you see there is vitamin C, vitamin E, but then you blend it and you put it in a test tube and you measure the total antioxidant activity, you will find that it has like not 10 units of vitamin E, but 800 units of vitamin E equivalent, yeah? So antioxidant is one. Anti-inflammatory is another one. The third function is the detoxification function. If you have liver cells and you look at certain enzymes that detoxify compounds from our bodies, those polyphenols activate those. Yeah, there are like 4,000 of them. They are in different categories, and they are not just in green leafy vegetables and fruits. They are in legumes. Soybeans have a lot of those phytonutrients that are very, very similar. Yeah.
A lot of primary physicians recommend CoQ10 for cardiac benefit. But there was a big study years ago that CoQ10 did not benefit Parkinson's disease. As a practitioner, I still get a lot of questions about that. Should they take it? Should they not? In your recommendations of supplements, you recommended vitamin D and the fish oils.
Omega-3 fatty acids, whether from algae or fish oil, or depending what your diet is. Yeah. In that review, it's a very nice review about supplements as it relates to Parkinson's disease. There are a lot of studies, and people are making PhD theses and working on this. And I'm not saying that down the road we will not have good data, and looking back, they'll say, well, you said that's not such a great idea, but now it is. Yeah. So science is always developing, and we have to be flexible and mindful. But just very difficult to understand why would just one of these nutrient make such a big difference. Now, there is big genetic difference between us. It's not harmful. Try it, test it. If you see that works for you, go for it. Don't stress about it. Don't worry about mechanisms. Do we understand? Do we, or not? If it helps you. Often, you start like this, and I see patients coming with 2 bags, and then it's like, which one is helping? You don't know, is it safe? Is it wise to spend $300 on monthly supply of those compounds that are isolated from the foods that we could be consuming? Now, if you are taking cholesterol-lowering medications of certain categories, there are some suggestions that taking 300 milligrams CoQ10 might be helpful. Yeah. Again, I would leave this to individual, but I would not focus on taking pill from that you can find in foods.
So along that same lines, when you talk about the self-care with experimentation, how do you experiment? How long do you give something? What kind of evaluation tools are out there to help you make a decision about that?
Yeah, that's a good question. So when I mention experimentation, what I'm meaning here is, let's say you never you tried to meditate, but you said, I couldn't do it, my mind was too active, and so on, and you kind of put this aside. Now you will hear from our experts how valuable that practice is. And so you might say, okay, I will hear this method, and this one has music in the background, this one has silence, this one has male voice, this one has female voice. That's what I'm talking about experimentation. Find the one that resonates with you. That's this period of experimentation, yeah? And you said, wow, that's the one. And often it's almost like music, I like this one, I don't like that one. And then you practice. You start doing this on a regular basis. Experimentation with foods, yeah? Maybe you don't like sweet potato, but suddenly you found on these websites that there is a good recipe for sweet potato hummus. Okay. What about ground flax seeds? Yeah, okay, I have high blood pressure. Ground flax seeds are pretty good at lowering blood pressure, so maybe I will experiment with that. That is that. So you try to see, 3 weeks, 4 weeks. Some people think that's what is needed to change your taste buds, to train them. Sometimes things aren't pleasant. And you said, okay, this coffee is not anymore that tasty without that creamer. Kind of doesn't feel right, but let me kind of expose my taste buds for maybe 2-3 weeks and see whether they get adapted. Yeah, that's that experimentation. That's what I had in mind.
I think along with those lines too, in the medication issues that we run into, we only make one change at a time. And if somebody wants to embrace the Mediterranean diet, I think it's hard to go full force, right? So
absolutely.
I think it's easier if you take maybe one step at a time, maybe 3 days a week you'll start with the Mediterranean diet and see how you can slowly incorporate it into being more of a habit than a hardship.
You said it so well. Yes, I agree. I usually ask my patients, I see them every 3 to 4 months, and we make a plan that they will try 3 recipes during that period of time. Because I can tell you, I work with Chef Jim Perko. Our offices were next to each other, and the kitchen was down. Before he perfected one of the recipes, I think I was just enjoying trying different versions. Is this okay? Should I add more of this? No, this is too soft. The point is, even professional executive chefs, they take time to develop something that you would say, wow, this tastes good. Yeah, so you have to be gentle, compassionate with yourself, and especially in our culture when we are not cooking and you are not feeling well. Yeah, you are not strong enough. It's very hard to cut that, butternut squash. So you kind of do those shortcuts. That's what we do with our patients. We kind of teach them what are the ways they can do to introduce more whole plant foods. And clearly it's a evolutionary process. Yeah.
Thank you so much, Dr. Golubic. That's
you
the
are
end
very
of the
welcome.
questions.
Thank you all. Have a great day and enjoy the rest of our program.